I'd like to introduce Heather to you, and Heather's a 21-year-old student. And Heather, we're talking to you because you've had multiple operative procedures. You started when you were 15 years of age. You're now 21,
Yep.
and you're a student.
Yes.
And you've had 4 operations in 6 years, and I don't know how you do that as a student, but that's a lot of
Multitasking.
that's a lot of grief, isn't it?
Yes.
Yeah, that's a lot of grief. And Heather was referred to us, and Heather, when we saw you, you had an unstable knee
Yes.
that was giving way on you. But you had a second problem, and that is you had a bow leg, and that was putting all the pressure on the inside part of your joint, wasn't it?
Yep.
And so we had to counsel you that you needed 2 operations. You needed an operation to straighten your leg, and that's called an osteotomy, or HTO, where we take a little wedge of bone out and straighten your leg, and that's a big operation. And you underwent that operation, and now you have a straight leg.
I do.
But that's a difficult operation to go through. And do you want to explain, first, when you go to a doctor and he says, I can't fix this, just a ligament, I now need to do something else. How did you feel about that?
I was a little bit blindsided. I wasn't not expecting to hear that I had to have that big of a surgery. So it took a minute for me to wrap my mind around that. But in the end, you have to do what you have to do to make it better.
And did the staff help you with that and give you all the information?
Yes, they did. They
that you needed as a patient?
Yep. They answered all my questions that I had, were able to tell me my recovery time, the therapy that I would have to go through, the pain level I'd be in. So.
Right. So we get bragging rights on the staff, wouldn't you say?
Yes.
They really work with you,
Yeah.
and they really work hard with you to make sure that you understand that.
Oh, yeah.
So you did go through the operation. You now have a straight leg. You can straighten that out, and before her leg would angle in. This was an incision that we had to use before, but we cleaned it up. We made it more plastic, and you were having all that pain on the inside.
Yes.
And what happened to that inside pain once you got your leg straight?
It's virtually non-existent. I hardly have any pain ever anymore.
Yeah, that's really good. And we can't promise that to everyone, but you had all your pressures going to the inside part of your knee, and once you got a better gait and you were walking, you had a better distribution. We kind of said it's like lining up a tire, right?
Yep.
Did you hear us say that?
Yep.
Okay. Well, I'm glad you had a good result from the osteotomy. And so you don't mind if we use you as a little bit of a patient
No.
testimonial, because people are very worried when they hear us say that.
Yeah.
And then just to fast forward, we then had the second problem that we had to go back and now stabilize
Yes.
the joint. Sometimes we can do those 2 operations together. Other times they're so big that we'd rather take care of one problem and then go back and do the other one. So you're only 5 weeks from getting your new ligament put in, aren't you?
Yep.
And how's that been?
It's been very good. So a lot more stable. You know, I feel safer when I walk because I don't feel like I'm going to give out or anything.
That's great. So we're pleased with that. And since you had so much surgery here, we recommended that you go to the other knee and take a graft out that gave us great stability.
Yes.
And so you're only 5 weeks away from that. Straighten your knee out. We have a nice little cosmetic incision. And that's been okay for you, hasn't it?
Yes, it's been very good.
Been good. So it's given you a more stable knee. And so now that we've got a stable knee and we have a straight leg, we're missing one part, aren't we?
Yes.
We're missing a meniscus.
Yes.
And so we hope to end all of this with putting a meniscus transplant in. And that's down the road a little bit,
Yes.
but that's to help protect your knee. And again, a meniscus transplant, we've told you, is there's a positive and there's a negative. Right now, they don't last forever. In fact, they last, if we're lucky, 7 to 8 years, so you may need another one. In fact, we can tell you you will need another one. And so it's a short-term solution, but not a final solution. And people are working very hard around the country to come up with the right meniscus transplant. And so we'll have one put in, and then we hope that the next one that eventually has to put in, maybe that will be a final answer or close to a final answer.
We can hope.
We can hope. Okay. Well, you've been a very good patient. What would you tell patients? Do you have a strong demeanor? What gives you that coping ability?
Discipline, self-discipline.
Self-discipline.
You have to do the therapies. You have to be dedicated to making your knees better and building the muscles around them, or
Yeah.
anything you guys can do is not going to last as long.
Yeah, and you've been very disciplined on that, haven't you?
I've tried my hardest to be very
Yeah,
disciplined.
that's right. And what are your eventual goals after school? What is your eventual professional goals?
I'm getting my degree right now in finance, so
Good.
I want to be somewhere in that
In the
field.
finance, well, that's an excellent area to go
Yep.
into. We need your help. You've been a great patient.
Thank you.
You bet.